Hi, all. Welcome back to the Congressional App Challenge Debugged podcast. My name's Medha, and today our host will be Suhaani, who's a member of the Debugged team, and she'll be leading a panel all about healthcare, medicine, and technology and what that intersection looks like. So I'll pass it over to Suhaani to lead the panel.
Thank you, Medha. Again, I'm Suhaani, a junior based at Saur Valley, and I'm a CAC alumni from 2023 from Arizona's 2nd District, and I look forward to getting started. So today, like Medha said, we're going to be talking about the intersection between medicine and technology with Maddison, Chau, and Medha. So Maddison, do you want to go ahead and introduce yourself first?
Hey, my name is Maddison Chau. I'm a first year undergraduate at UCLA and I'm majoring in biology.
Awesome. So first, I just want to ask you guys, like, what got you interested into the intersection of technology and healthcare, and what introduced you? So, Madison, do you want to take that one first?
Yeah, sure. So I've always been interested in healthcare. Ever since I was a little kid, I had an interest in cardiology and how the heart works. I started coding in 5th grade, and I wanted to learn how to help my community in a way that combined these two interests, so like cardiology and just coding and Python and JavaScript. I also had an interest in surgery robots, and so I started doing small projects related to healthcare. I did research into artificial kidneys, artificial heart valves, and then I participated in engineering fairs to build these projects and make them into reality.
Awesome. So, could you go ahead and explain a little bit about one of your projects, maybe, and got, how you sort of like made up the plan, how you did your research?
Yeah, sure. My most recent engineering project was in my sophomore year of high school. It was for my district and my county's science fair. It was a mask for deaf individuals. So my idea was to make a clear mask or any sort of mask that could help deaf patients when going to the hospital or just to go see their doctors, because during COVID, of course, we couldn't have in-person interpreters in the room. And some doctors unfortunately don't speak ASL or would be able to communicate with their deaf patients. So I decided to make a mask that would take in speech and then use a coded algorithm to represent the wearer's speech using an LED display. So the way I went about researching that was first, of course, consulting studies of deaf communities, like what they needed, anything that would help them get back into clinical environments without having an in-person interpreter to decrease the spread of COVID. And then based on that, I wrote my algorithm in Python and I used an Arduino to connect a mask to an LED display.
Awesome. And Medha, do you want to talk about what introduced you between the intersection?
Yeah, for sure. My story is actually very similar, but slightly different, in which I was never truly interested in healthcare. I felt like all of the different projects I pursued, ended up leading, for me to be in the intersection between healthcare and technology. It was something that kind of just like happened. But looking back on it, I see how my story could be harmonious. One of the first healthcare and technology projects I worked on was an automated medical like pill dispensation system, which basically allowed it was a machine that we wanted to distribute to seniors in particular, or anyone who's vulnerable to drug overdose or drug underuse. And based off of connecting that automated technology to an app that connected them to their healthcare provider, it would automatically dispense and detect when pills are taken and if they're taken, as well as connect to the pharmacy if there are any refills that are needed. So that was like my first exposure to like the intersection between medicine and technology and all of that. And then now I currently work in the healthcare space at Adobe, where basically we work with healthcare clients. I primarily work with payer and providers, but part of my team also works with pharmaceutical companies and med tech companies. And the whole idea is that we provide B2B marketing technology solutions to help them reach their customers better and help make more cohesive and personalized experiences. And so it's really interesting because for that, I've had to learn so much about the healthcare industry. And it was something that I had never expected. But looking back on like my past and all projects I've done, I'm like, oh, I have actually had some exposure to healthcare. And so that was kind of like a full circle moment for me.
And so since you actually do tackle those types of challenges, what's like the biggest like challenge or opportunity even that you feel that technology could fix in the healthcare system?
Oh my God, there's so many things, right? Like everyone's talking about generative AI right now, and there's so many really cool applications of generative AI in the healthcare space that clients in the provider and payer space constantly talk to me about. I think one of those is I think there's two that I want to touch on. One of those is like from the marketing technology perspective, content supply chain. So being able to create and deliver the most personalized advertising or marketing content to consumers, and also like to basically like if let's say I have a checkup that I need to go to for an annual checkup, like the ability for like um my healthcare provider and my healthcare insurance company and all of the people involved in that process, they know like in 2 weeks I like that's the deadline for me to do my annual checkup. Things like that are things that like you can have in like seconds with this new technology, whereas before it would take like thousands of people to like detect that. Like they would have an algorithm to detect it, and then someone would have to personally reach out to me and then follow up with me. All of this is just triggered automatically. So like the next best action type of behavior. And then the second opportunity I think is like when it comes to just aiding people with managing their care. So like using wearable devices that like I think the Apple Watch does really well right now, but there's so much potential for like the Apple Watch to be able to like detect if someone is okay or like something like that, send a notification immediately to their doctor or the right doctor, right? Like if they develop like if they have some issue like if they have like a cardiovascular issue that's detected by the wearable device, it automatically pings the right like cardiothoracic surgeon. I don't know, right?
Mhm.
So I think there's like some really interesting applications that are just being discovered and just being talked about. And I think like with that being said, like there's no way that like people in healthcare or people are being replaced or anyone's losing their jobs. That's just like not the case. But I think people can feel more supported in their jobs. That's definitely the future.
Yeah, and coming from the fact that you actually work in that field, that makes a lot of sense. And for Madison, since you're up and coming into that, what do you feel could be one of the biggest challenges or opportunities that technology could help with?
I actually volunteer in a hospital right now, and I deal with patients and like bedside care, and they have iPads in the hospital, and I think it's really helpful for like not only entertaining these patients while they have to stay in the hospital for long periods, but they also have videos on how they should take care of themselves, um, just how to take their medications, why they should be taking them, any like resources that they may need to get in contact with the hospital. I think that it's difficult for older patients to accept that this is what's going to be more common in hospitals just because of a distrust of technology and just not being used to using these apps and iPads. But I think that as technology becomes more intertwined in healthcare, then it's just for the benefit of the patient. So I think that as time goes on, then they'll be more accepting of it.
You know what's so interesting is like that's kind of exactly like I mean two parts to it. Like first like yeah, there's going to be distrust and like rightfully so, right? It's good to be wary of new technology especially when they have access to such personal data. But like what I said about content supply chain, one of like the main goals is creating educational content exactly like you said, by making it like hyper personalized to the person. Like they know your name, they know exactly when you have to take your pills, they know exactly like which pills you're taking and like who important people in your family are. And it sounds really creepy, but like, and it is, to be honest, it really is. But it's just like, it makes the experience so much more like personal. And like, it makes people feel, at least from my perspective, it makes people that are receiving that care feel so much more like, for the most part, feel like they're actually cared for, you know?
Mhm. Yeah, I totally agree. And then, of course, when there's a nursing shortage or staff shortage,
Yeah.
having these iPads be more personable and like, talking to the patient using their full name or just
Yeah.
being a welcoming source of how they can take care of themselves. I think that's really important.
So for you guys, would you say that since you guys also have backgrounds with technology and the healthcare, you can sort of like how would you say you can bring innovation into the healthcare field as a larger part? Because as you said, it really elevates like how people are cared for in the hospital, which is obviously usually something that people are kind of afraid of and they don't really enjoy. So how can technology sort of aid that process? Madison, do you want to go ahead and go first?
Yeah, sure. I think it's really important to communicate to patients that although technology is becoming a bigger part in healthcare, at like very high levels, there's still humans involved. Because I think that patients are really, really concerned about all their information, like you said, being taken and just put in technology and they don't know where it's going. But I think it's really important to tell them that yes, the computer is going to have access to your information and will be talking to you in order to help you with your journey in the hospital. But humans are still involved. Like humans write the code, they have your best interests at heart. And I think it really relates to the quote that resonates with me a lot. It's a computer can never be held accountable, therefore, a computer must never make a management decision. So I think that patients would really appreciate just like knowing that management decisions, like really important actions that the computer will be able to do, like let's say prescribing new medication or a new treatment plan, has to go through a doctor or physician first.
Yeah, I totally agree with you. And there's some statistic that says, like, when there was some huge survey done, right? I wish I knew the exact sources and the exact numbers. But there was some huge survey done amongst healthcare patients, members, consumers, all of the above. And it's something like 65% of them are totally fine with giving up their data and their right to privacy in that sense to technical systems, as long as A, their privacy and security is governed by HIPAA, and B, right, like they're actually using it for good and not just using it to store that information. And what's really good is like, I think data transparency and technology transparency is so important that I think a lot of people aren't getting right now. Um, and I'm talking about not just patients and members, I'm also talking about like people that actually work at healthcare companies. They don't get a lot of transparency as to like what this data is going to do or what this technology is going to do. So I think that's a huge opportunity that needs to be discussed and explored further. And like, as you said, right, like it's so clear like that it's a very clear policy with like the American Medical Association or like any type of like medical oversight organization that like management decisions, as you said, Madison, cannot be made by a computer, especially when it comes to someone's life or care. But like people don't know that. Like that's just not like widely known. And I think just like creating transparency around like all technology used to store PHI or make decisions in any sense or any capacity all have to be HIPAA ready. They all have to go through like a very robust process to even be implemented. And then there's checks and balances on that as well that include a human touch. And I think like that type of transparency doesn't exist right now and it needs to. Otherwise, people across, are not going to trust the technology.
So now that you're talking about like how this sort of technology should be developed, is there like one particular app or tool even in the healthcare industry that you find particularly innovative or useful, Medha?
Yeah, I think that I would be in trouble if I didn't say my own company, and what we're doing. But pretending like, I can't plug the Adobe Experience Cloud healthcare technology stack. Assuming I can't plug that. I think that there's a lot of really interesting and cool technical innovations, and I find it really difficult to pick one, only because I think the most powerful ones are A, the ones we haven't heard of yet, and B, the ones that will affect the most people. And so I think like if I really had to hone in on something, I think some sort of like virtual assistant. Like I was following ChatGPT 4.0, that release that just came out by OpenAI in the last week. Although by the time this podcast comes out, it'll be a couple months old. Regardless, I think like a virtual assistant that really is just like there and on, like enhancing everyone's everyday life, everyone that uses it. I think like that's something that would be a really cool innovation, but like honestly, I don't know because I think the best ones just like haven't been invented yet and would be the most like not to say they wouldn't be invented yet, but they would be the least likely to be like, wow, this has so many applications in healthcare. I think it would have to be something that's super integrated into someone's life, which is why I think like a virtual assistant or something like that would be really interesting, especially if OpenAI's deal with Apple goes through, where they integrate Siri with the intelligence of ChatGPT 4.0. That would be really awesome.
Yeah, I agree. There's just so many technologies being made like every day, but I think like the first thing that comes to mind, like regarding healthcare and the intersection of technology, is just one that's already like widely used. So many hospitals and like urgent cares and all these clinics around the world have like websites where you can go on and schedule an appointment or find resources that are related to your doctor, like the phone number, or some of them even have like virtual assistants on the website themselves. And I think that this integration is just like very important because you can one like schedule an appointment without going in to the clinic or calling in. So people who aren't able to do that just can really easily on the website. You can see like your health records, anything that's stored on the website, just without again calling in or going in person. And I think that's really important for people who can't physically make it to the office or just are immunocompromised in any form and can't risk getting sick again.
Oh yeah, that's a really great point. Like telehealth and the rise and like robustness of telehealth is really important. I totally agree with that.
And I just want to have one last careers in healthcare and technology or like even digital health startups. What would you tell them, Madison?
I think that the intersection of health and technology is just such a huge field, and that anyone can join in if they want to. There's really something for everyone. For example, like lobbying, there's so many clubs that you can join where you can lobby for more accessible healthcare for marginalized groups. You can join just general health clubs where they'll teach you about maybe things that you aren't aware of. So, like, how you can help people or just be more sensitive to people who, like, for example, have diabetes, and just doing your own research into technology that's being made currently for the healthcare field is just really important. And I think that there's room for everyone. So let's say you're not interested in like the science aspect or the computer science aspect. I think that you can find your way and just find your place in it and just help people who need healthcare. So.
I totally agree with you, Madison. I think that like there's so many different avenues from healthcare administration to working on the payer provider, pharma, med tech side. Like there's so many different places. And also, Suhani, like you mentioned, I think like a startup is a really interesting place. I think I have two pieces of advice. First is like make sure you familiarize yourself with like the privacy security regulations when it comes to healthcare and all of that data because likely the likelihood of you working with PHI and like really protected data is really high if you're looking to be in that space. So make sure you know what it means for things to be HIPAA compliant and HIPAA ready and like familiarize yourself with that and take that very seriously from the beginning. And then the second piece of advice is like I think very much in line with what Madison said, right? Like there is literally like this is one of the things that is most important to someone because it's literally something that we use to live. And like there's so many different ways to approach it, right? Like a lot of people don't agree with the way the current healthcare system is set up, right? So like say something like there's so many opportunities to say something or create something that will like help change that. I think is my perspective. But with that, thank you all so much for joining us. Suhani, thank you so much for hosting. Madison, thank you so much for being on the panel. And thank you to our listeners for being here and taking a chance on this episode. With that, we will see you next week with a new episode. Bye.